Good morning and welcome to today's Return to Campus Town Hall webinar. My name is Dr. Brian Hamluck and I serve as the Associate Dean of Students and Director of Administration here at the University of Pittsburgh. Today, I am pleased to facilitate a session with key leaders on campus and in the medical field covering the important service areas of housing and move-in, dining services, academic affairs, new student programs and welcome week, campus recreation, student health services, and COVID-19 topics, including testing. We will start with each panelist giving a brief overview of the key current topics from their areas, and then we will have time to take some questions at the end. If you have questions, please utilize the Q&A function at the bottom of your screen. For the purpose of this session, please keep your questions broad in nature so that all participants can benefit. If you have an individual, specific, or nuanced question, we will be providing contact information for all of our key areas at the end of the session for you to follow up with. With that housekeeping information taken care of, let's get started with our first panelist to provide some information on housing and move-in. I'd like to introduce Kathleen Kyle, Director of Housing and Panther Central.
Good morning. I hope everyone's having a good Thursday morning. We are in our final day of first year student arrival here at the University of Pittsburgh. We're very excited. Things have been going very smoothly. In terms of the audience today, I'm not sure how many of you are waiting to move in or have already moved in, so I will try to keep my comments brief. In terms of move in, please do your best to follow the instructions you've been provided in regards to your arrival time, parking, having a single helper, having your ID with you, whether that's your PIT ID or another photo ID in order to receive your PIT ID. All of those instructions are very important and they will help everything go as smooth and expediently as possible. Other things about arrival, please just know that Oakland is continuing to become busier, right? This is a cumulative effect. So as you arrive on campus, or if you're an upper class student and you're preparing to arrive on campus, just be aware that there's more pedestrian traffic, there's more vehicle traffic, there's less street parking available. So please follow those signs and please follow the instructions we've given you on both short-term unloading as well as your long-term extended parking. I wanted to touch a little bit on health and safety in the residence halls specifically, and let you know that we have updated all of our housekeeping guidelines, all of our common areas, elevators, stairwells, bathrooms, all of those things have been they're going to be cleaned twice a day instead of just once a day by our staff. It's going to be very important if you live in a residence hall with a common bathroom, the time of your bathroom cleaning is going to be posted clearly. It's going to be very important that you pay attention to that and that the bathroom will be closed for cleaning twice a day for about 45 minutes during each cleaning. If you live in a residence hall or a suite or apartment where your bathroom is internal to your own living space, we are going to be giving you a bucket, a Pit Shines bucket that's going to have some cleaning supplies in it for you, a mop, toilet brush, some sponges, some cleaning solutions, some disinfecting wipes, and those are for you to help us help you keep your space clean. There will also be instructions about how to get additional supplies if you do need it. Just know that a couple of other things we paid attention to this year in terms of HVAC, making sure all of our HVAC systems are meeting the CDC guidelines, and making sure also that if you do need maintenance in your residence hall space, that we will be making sure that all of our maintenance workers will be have their masks on. They will ask you to also have a mask on if you're going to be in the room while they're doing the work. They will disinfect the area, perform the service requested, and disinfect again after they've performed that service. If you've got questions or you need additional support with that, please reach out to Panther Central. The last thing I'll just say is as you're on campus, please pay attention to all of the signage that talks about physical distancing, where to stand, where to queue for elevators, how to do that safely, and just know that we are all on our side trying to take that seriously. Please help us out with that. I know that sometimes it gets hot or it's uncomfortable, but wearing your masks, standing in the appropriate places, and following all of our guidelines are really going to help us be successful. I'll pause there. If folks have questions later, I'll be more than happy to answer them for you. Thanks so much.
Thanks so much, Kathleen. So obviously our students need to be able to have a place to sleep. So that's where move-in comes in. And then the next thing, they need to be able to eat. So I'm going to have Joe Beeman, our Director of Dining Services, talk about dining services on campus and all of the great options that are available to our students.
Thank you, Brian, and welcome to Pitt, everybody. I get a chance to talk about one of my favorite things, and that's food. Our new dining program, Pitt Eats, has taken a number of important safety measures, right, during this COVID period. I did want to talk a little bit about what we've done and talk about the program as a whole. So one of the things that you're going to notice on campus is we've really done a lot of wayfinding, and we recommend, please tell your students, and if you are a student on this call, to follow those guidelines, to follow those signs. There are now over 15,000 signs on this campus, and this was done with the help of our design and real estate team, who really understand how to make the most efficient flow so that physical distancing can be followed. So a couple of things that we've done in dining services. You're going to see, let's first just talk about the safety. You're going to see plexiglass everywhere. We've installed them at every location that we have. We are really concentrating on physical safety distancing with our program. You're going to see, our team does daily health checks, temperature checks. One of the nice things in dining services is we've always been really cognizant of our hygiene practices and making sure that we're constantly washing our hands, constantly changing our gloves. All of our staff has taken COVID training. And so this has been something we have taken very, very seriously over the course of the summer. Let's talk now a little bit more about the fun piece of dining, right? The experience piece. So not only do we have great all-you-care-to-eat options that are to-go only for this time period at the eatery, but we've also opened 2 new dining locations for the fall. So if you are staying at the Residence Inn in Bigelow, we opened a dining hall there so that you can have all of your meals on site. Breakfast, lunch, and dinner are served. The menus are rotating. We're constantly adding some new things there. So this is an attempt to make sure that it's a little bit easier for you if you are up at the Residence Inn. One of my favorite new places is the outdoor open air dining, as we've been calling it, the Hub on the Posvar patio. So we've opened 3 different retail operations in our largest covered patio area on campus that are all going to be part of the dining program. It's a grab and go, but it also kind of brings you into open air spaces so that students could either grab their meal and eat it in their room, or they can safely physically distance and eat it outside on the go. So these are a couple of things that we had opened. We also opened an all you care to eat portion of the Hub at Posvar patio. It's really been an effective way to allow students to physically distance while still getting the experience and the made-to-order cuisine that they require. I also want to talk a little bit about our new meal plans, and there's a meal exchange component of this. This has never been more important than it is right now. So the meal exchange allows in all of your meal plans for 1 meal every day to be utilized at any of our retail dining locations. So you could go, I had a student tell me that they are going to go to Chick-fil-A every day this semester. While I might not recommend that, you are more than able to do that with your meal plans. But all of our dining locations, our Fort Pitt Sub Shop, we've got a Shake Smart who's going to be opening on campus in October up at the Peterson Event Center. Any one of our locations does accept this meal exchange. And what this has done is helped to de-densify our dining hall locations by spreading out students throughout the day to utilize their meal plan in a retail environment that hasn't been used before in our program. Really excited about that. The other piece I want to speak real quickly about, and this helps with our de-densifying efforts, is our new Pitt Eats Local program. So through the pandemic, the University of Pittsburgh has really looked at ways to engage the local community. We know that the Oakland businesses really rely on us as we rely on them. And so 25% of all of your students' dining dollars when they buy their meal plans will be able to be used at local family-owned businesses throughout the Oakland area. This will kind of help de-densify even further while also supporting small businesses within our community. I would recommend everybody go to the dineoncampus.com/Pitt so that you can see all of the safety protocols and all of the options available for your students. The last piece I'm going to mention is we are a very allergy-friendly dining program, and I would recommend that anybody with allergy dining needs would reach out to Kristen Grover, who is our registered dietitian, again, on the dineoncampus.com/Pitt website. All right, thank you. Welcome to Pitt. Brian's back to you.
Thanks so much, Joe. One of the things that we've been working really hard at here at the University of Pittsburgh is creating an academic approach that really responds to the needs and the level of comfortability that our students have during this time. And so to talk a little bit more about Flex at Pitt and some of our academic approaches for the fall, I'd like to introduce Dr. Julia Spears, our Associate Vice Provost for Academic Innovation. Julia?
Thanks, Brian. So good to be with you all today. It's day 2 of our fall semester, so welcome everyone. As you know, there was a big announcement yesterday by Provost Cudd, so I recommend that you read it in full. Essentially, all classes, as you know, started out remote, and we're going to continue in the remote phase through September 14th. Now that's assuming that everything goes as planned and there's no additional spikes and other things that are tied into bringing students back in the classroom. So right now, just want to remind everyone, we're in the elevated risk posture. So the Flex at Pitt model is tied to the operational postures of the university. You can find information online, and I'm going to reference a lot of information in the next minute or so at pi.tt/Pitt Student Success. So there's information on what Flex at Pitt is, all the different modalities that the classes will operate within. And then also, I want to remind everyone that classes are both synchronous. So, you know, you have a class at 9 a.m. You all come online in your Zoom call at 9 a.m. That's synchronous. They're also asynchronous, meaning you can attend the class at a time that is different from the class time. So this is important because, as you know, students are still moving in. Sometimes your move-in time would conflict with when you're supposed to be in class. And you can get all of that information still online. I want to remind you also that we added some time in between classes. So every single class, when we come back in person, we'll have a 15-minute passing period. So I encourage you all to look in PeopleSoft. All the classroom assignments are done. You can see your updated time. You can also make sure that the new meeting times based on the passing period and also how your classroom is being delivered. So if your class is entirely remote, you'll see that in the Student Center under the Notes section. For some people, we've been getting a lot of questions on when will I find out information about my classes? Most instructors have already sent out information on how you can connect via Zoom. I also encourage you to use Canvas. Canvas is where all of your class information will be. You can access Canvas site at my.pitt portal, in addition to the Pitt mobile app. So all of your course information will be on Canvas. Instructors are constantly adding content there for your classes. It'll tell you how to connect to the class, your assignments and everything. So please go there. If you're not seeing the information that you want on your specific class, or an instructor doesn't have their information up, reach out to them directly. You can do all of that through Canvas. Couple of updates from the email that was sent out yesterday. As you know, there's a new class. It's a free class, a 1 credit hour class called Anti-Black Racism, History, Ideology, and Resistance. And all full-time freshmen have been enrolled in this class. It's asynchronous. You can take it, you'll do it at any time. It's about an hour or so a week. Really exciting. All students can take it. All students can take it, but you weren't automatically enrolled. So if you have questions on that, you can reach out to our office. Information is on the Provost site. It's also linked off of that pi.tt/Pitt Student Success website as well. I'm excited to announce that we finally have a listing of study spaces. So, you know, most students are in the room. They're sheltering in place. We know that classes are remote right now, but we don't want you to feel limited by where you can go. So on the website, Student Success with Flex at Pitt, the pi.tt, I'm gonna say it one more time, pi.tt/Pitt Student Success. There's a listing of all the open spaces that we have kind of created a comprehensive list and the times that they're available and the days that they're available. So classroom spaces that currently are not being used for a class, or there's not something scheduled in there, you'll see when there's availability. If you wanted to get out of your residence hall and safely study in a different location. So there's a hyperlink to a page, it has it all listed. I will say those spaces are not going to be available until Monday, August 24th. There's still installation of certain equipment, making sure everyone is safe. So while the listing is live now, because I wanted to reference it today, the space will not be available until Monday. In addition, Hillman Library is scheduled to open on Monday in some truncated hours. So there's going to be some options for you, so you can move around campus safely. Let's see, study space. And then the last thing I would just say, there's a lot of links that we're trying to put on this Student Success at Flex at Pitt website. Some top 10 lists in terms of how do you set yourself up for success in the Flex at Pitt model. Because there's a lot of moving parts and things are shifting, this model is dynamic and it's responsive to what we're seeing in the academic environment on campus. So as we know, hopefully when we will move from the elevated wrist posture to the guarded wrist posture, you will also get some formal announcements of when classes would begin back in person. If we do begin back in person, then your classes have been tagged in PeopleSoft. So when you go back to the Student Center, you see your class schedule. They've been tagged one of the 3 different modalities of Flex at Pitt. Either your class is entirely in person, meaning you're a small class, you fit within social distancing guidelines in the classroom. You'll see that's called the full classroom cohort, or you'll be a rotated cohort, meaning you might need to switch with half of your classmates, half the time you're in the classroom, half the time you're in a virtual remote space, that's rotated cohort, or it'd be fully remote where the recitation would just be in person. All of those notations are in PeopleSoft. So when you go and check your schedule in the Student Center, you'll see a little link and it'll tell you what that is. If you have any questions at all, we are always happy to answer them. You can contact the Provost's office or vpmccarthy.pitt.edu. Happy to respond to you. So I'll stop there and we'll take some questions if you have any at the end.
Thanks so much, Julia. Here to talk about our approach to programming and developmental opportunities with our new students and all of our students at Pitt, I'd like to introduce Breanne Donahue, our Interim Director of New Student Programs. Breanne?
Hi, thanks, Brian. So Welcome Week began last week, Wednesday, on the 12th. If you missed any of the required programs, they are all now uploaded on our website that you can view those at your convenience. So those were our health and safety at Pitt, building a Pitt community, the tipping point, and our new student welcome and our class traditions presentations. All 4 of those required events you can find on orientation.pitt.edu. So if you saw them and want to watch them again, I encourage you to do so. There's a lot of great and important information. If you missed those required events, please go and watch those. They are required for all new students at Pitt this fall. We do have some events still wrapping up Welcome Week this weekend. We have our big activities fair on Saturday. That is from 1 to 3 p.m. Of course, that is virtual, but we have over 700 student organizations at Pitt. We encourage students to go to our student organization website, another link. It's SORC, stands for Student Organization Resource Center, sorc.pitt.edu. I always encourage students to browse that website prior to attending an activities fair, whether that is in person or virtual, because we have so many. It's a great place to start to browse to see what all students can get involved in and what we offer, so students can find those spaces. And then students will be able to go to the activities fair, join Zoom links, talk to students, upperclassmen and they're in those student clubs and organizations, meet other students, things like that. So again, that activities fair is virtually this Saturday. We have an event tonight, Workout Through the Decades. So students are putting on a really fun event with music from 80s, 90s, and 2000s, a great way to blow off some steam. And then on Sunday, we are also having some personalized campus tours that will be hosted by our first year mentors. Again, on the orientation.pitt.edu website, you can see the schedule, times, and events, and links for all of those events that are wrapping up Welcome Week this weekend. The other thing I wanted to encourage you to do when it comes to events this upcoming fall is to sign up for text messages from the Division of Student Affairs. What you would do is you would text PITT SA, S as in Sam, A as in Apple. Again, it's PITT-SA and your username to 41411. So again, if my username was ABC123, my email, sorry, was abc123@pitt.edu, I would be texting PITTSA ABC123 to 41411. Again, you're texting PITT SA username to 41411. That way, students, once we are done with our, classes started yesterday, we're sheltering in place. There's a lot happening right now for students, but we want students to still continue to engage in a safe way. So, I encourage students to take a walk with their pod, grab a meal with their pod. It's another beautiful day in Pittsburgh. But downloading or signing up for that text messages, students will get real-time notification of events that will be happening this fall. Student affairs staff are busy planning a lot of events this fall term, and any other types of notifications that the university wants to push out through that text. If you have any questions, just let me know. Thanks, Brian.
Thanks so much, Brianne. One of the other things that we are proud of here at the University of Pittsburgh is the way that we take a comprehensive approach to student health, wellness, and well-being on campus. And our next three presenters are going to talk about some of their areas with respect to that. First, I'd like to introduce Jill Krantz, our Executive Director of Campus Recreation. Jill?
Thank you, Brian, and hello, everybody. We're excited about students returning to campus, and we actually just completed our student staff kickoff training this week, and our outdoor fields opened yesterday. So it was terrific seeing the students outdoors and just enjoying the great weather, as Brianne just said. One of the things as we look through campus recreation, I wanted to just start and provide a little bit of an overview of who we are and what we offer. So first of all, we do have several fitness centers on campus that have cardio and strength training equipment. Those are located in the Barrow Recreation Center, Trees Hall, and then also in the William Pitt Union. In those spaces, we have everything from cardio equipment, treadmills, ellipticals, bicycles, you name it, as well as free weights, squat racks, selectorized weight equipment. So you'll just see a variety of options to really help people stay healthy and fit. Up in Trees Hall, we also have 2 swimming pools. We have a climbing wall and a golf practice space, and then also 3 court gymnasiums that, again, these are used for a variety of activities, everything from basketball to large classes and that sort of thing. One of the facilities that we're really proud of is the Sports Dome Complex, and that's up on the hill, and it includes 3 outdoor fields and then also a massive indoor dome where we house 3 additional fields. And those are used very heavily by our intramural and club sports. And then just let me offer a little bit of information about some of the programs that we have. We have, as I mentioned, intramural programs, fitness and wellness programs, and club sports. For intramural programs this fall, we have done some modifications, and we've done that to support physical distancing and, of course, minimize the physical contact and personal contact. So our sports this fall will be dodgeball, volleyball, kickball, and then we're also offering esports, which we started this past summer and proved to be really popular with the students, another way to connect and get involved. You'll also see in-person group exercise classes and then some virtual programs that we're offering real time as well as recorded so that people can plug into those. For students interested, we offer a free wellness consultation, and that this semester will be virtual. But again, it's a great way for somebody to get a baseline on where they're at with their general health and a fitness from the stretching and ability to cardio, those sorts of things. We also have a number of clubs. Our sports clubs are over 70 in number, and they're both competitive and recreational. And the competitive ones tend to have more practices, a little bit more consistency, and the recreational ones are a little bit less competitive, but a variety of sports, everything from archery to basketball, soccer, equestrian, ice hockey, basically pretty much anything you can think of. And as Brianne mentioned, the activities fair is coming up on Saturday, and those club sports will also be represented there. So if you're interested in learning more about them, I would really encourage you to attend that fair virtually or look at our website because we've got quite a bit of information there. From the standpoint of supporting the health and safety guidelines this fall, there will be some changes, and I just wanted to go through a few of those as we get started here. So our outdoor fields are open, as I mentioned, and our indoor facilities will open on September 5th. And with all of those spaces, the major change that you'll see is we'll be having students making reservations to use those spaces. And we've done this obviously to support physical distancing and occupancy limits, but most importantly, the real reason behind the whole big picture of it is we want to make sure that students, when they know they have a time in their block during the day to work out, that they can come up and do that and not have to stand in line and wait. So they'll be able to come in during that time frame, get a workout in, and then go on with the rest of their day. Within our spaces, there's been a lot of changes, like everybody else has mentioned. We've moved equipment around, so it's spread out quite a bit more, and people will leave space between like a treadmill they'll work on, and then they'll leave a couple of pieces blank, and then there'll be somebody on the next piece over from there. So that'll just be a little bit different from folks rather than tightly spaced in all of our buildings. The other things that we've done is we'll be looking at our high touch spaces and cleaning those really frequently. Our students will be helping with that. And then there'll be deep cleaning overnight. And then just as important to all of this is we're really asking you to help us. As people use equipment, we want you to wipe it off before and after. And again, it'll just be one more way that we know things are being kept clean. Lastly, I just want to talk a little bit about a survey we did last spring with students. And we found that the reasons that they participate with campus recreation, a couple of the top ones are making friends, being active and healthy. And then the last one, of course, is managing stress and providing a positive break from other commitments. And this fall, our team's here to continue to support those same reasons and help students really have a good outlook on their semester here. I encourage you to take a look at our website to learn more about our offerings. And I guess with that, I'll just pass it back to Brian for the next panelist.
Great, thanks so much, Jill. Here to talk about our medical services that we have on campus for all of our students, I'd like to introduce Marian Vanek, our Executive Director of the Wellness Center and Director of Student Health Services. Marian?
Thank you, Brian. Good morning, everyone. As Executive Director of the Wellness Center, I'm very pleased to provide you with some information about our services and some of the recent changes that we have implemented here to better serve your needs this semester. The Wellness Center is an integrated service that consists of a very large outpatient medical clinic, a counseling service, a full-service pharmacy, and health education program. We maintain a patient-centered philosophy with a very strong commitment to quality. We are staffed by highly trained board-certified physicians, physician assistants, nurse practitioners, psychiatrists, nurses, psychologists, counselors, social workers, and pharmacists. We even have a full-time dietitian on staff. We are accredited by the American Association of Ambulatory Healthcare on the medical side, and on the counseling side, we are accredited by the International Accreditation of Counseling Services. Just to give you a little bit perspective in regard to our accreditation status, less than 35% of student health services in the country are able to achieve this accreditation. Since the pandemic, and to ensure the health and safety of our students and staff, we have implemented a new and safer way to provide health care for our students. This includes the introduction of telemedicine, teletherapy, online programming for all health education and Healthy You programs, as well as curbside and mail delivery of our prescriptions and other pharmaceuticals. We do provide on-site medical care when appropriate for services such as immunotherapy, various medical procedures, injury care, sports medicine, immunization, specimen collection, and testing for such purposes, including COVID. However, to ensure the health and safety of our staff and our students, all appointments must be scheduled in advance. At this time, we will no longer offer any unscheduled appointments. When you call the Student Health Service, a nurse will assist you with scheduling either an in-person or a telemedicine appointment with one of our providers. Also, for your convenience and safety, all forms, consents, medical history forms can all be completed online prior to your appointment. This can also be done through our secure portal. I think we can all agree that we're living in a very challenging, concerning time. However, by supporting one another, I believe strongly that we can reduce the risk of COVID spread on our campus and complete this semester very successfully. We all have an obligation to not only protect ourselves, but also one another. We can do this by knowing the facts and practicing safe mitigation measures. Risk-reducing behaviors do matter. First of all, gain some knowledge, know how the virus spreads. The best way to prevent an illness is to avoid being exposed to this virus in the first place. And like other coronaviruses, the novel COVID-19 spreads mainly from person to person through respiratory droplets from an infected person. And this person can be symptomatic or asymptomatic. As a result, it's very important to wear a mask all the time while you are on campus. A mask reduces the spread and protects others, but it also can protect yourself. Pitt will be distributing 2 Pitt-themed masks to all incoming freshmen and all incoming students, actually. Please wear them in pride. Also, you want to avoid close contact with others. Remember that some people without symptoms, those who are asymptomatic, may be able to spread the virus. Stay at least 6 feet apart from others, which is approximately 2 arms length. And then, of course, you want to practice good personal hygiene. Wash your hands often. And once you arrive on campus, you will notice that there are multiple sanitizing stations positioned throughout campus. Take advantage of this. And then lastly, and perhaps even most importantly, monitor your health. Take charge of your health. You want to know the symptoms of COVID and to be alert. You want to watch for fever, cough, shortness of breath, any body aches, headache, loss of taste or smell, or any other symptoms that is associated with COVID. If you develop these symptoms, stay in your room, then call Student Health, and you will receive guidance. Again, if you develop any of these symptoms, please stay in your apartment or your dorm room, and then call us. We will provide guidance on next steps. And please don't hesitate to give either our Student Health Service a call or myself a call to answer any questions you may have regarding this topic or any of the services that we provide. Information will be provided at the end of this presentation. And good luck for a very successful semester.
Thanks so much, Marion. And our last panelist this morning is a representative from our COVID-19 Medical Response Office. And I'd like to introduce Dr. Elise Martin, our Associate Medical Director for Infection Prevention and Hospital Epidemiology at our University of Pittsburgh Medical Center. Dr. Martin?
Hi, thank you guys so much for having me. As you mentioned, I'm a member of our COVID Medical Response Office, and we've been working with a number of people across campus to help come up with strategies to help make campus as safe as possible. One of the big things that we've been doing is a lot of work on surveillance testing. And what we mean by surveillance testing is we're taking our asymptomatic students or students with no symptoms and randomly testing about 10% of our population to find out what is the approximate prevalence of the infection on our campus in those who don't have any symptoms. We did release some numbers on Monday on our first round of surveillance testing, and are really pleased to say that the rate is very low. I think this is encouraging. And I think this is something that we're hoping we can maintain while on campus. We're doing additional testing this week, and we will be giving weekly updates on all of those testing results, as well as the results of any additional symptomatic cases that we have as well on our campus. So you will be receiving regular information on all of these events. Some of you may be wondering what happens to students if they do get identified as positive or if they do have symptoms. We do have a great process starting with student health, involving basically all sectors of campus to, once we've identified students, get them notified and address all their medical concerns, and then get them appropriately into isolation housing, where we can continue to monitor their medical status as well as keep our campus safe. We've spent also additional energy to make sure that we're addressing all of the people who they've come in close contact with. We have a team of contact tracers that will notify all their close contacts and then ask them to quarantine in case one of those additional contacts may have contracted the virus. We want to continue to keep these rates low. We've been doing this thus far based on these initial positive cases, and it's been going really well. For all of the students who have been tested, I really want to thank you for all of your efforts to come out. You guys have been on time, have been professional. You guys have taken this really seriously, and I really, really applaud you for all of that. For the students that have been identified as either positive or those who have been asked to quarantine because they were a close contact, I would also say that those students have done a really fantastic job to keep our campus safe by complying with all of this to make sure that we identify anybody who has symptoms and do our best to prevent the spread on our campus. So again, I really just want to say thank you for all of that, because you guys have really been, putting forth that effort to help keep campus safe. Going forward, we have additional testing days this week and next week. And like I said, we'll be giving out those results weekly on all of those test results. Anyone who gets tested, though, will find out sooner than that if they either tested positive or negative, and then what the next steps are if they did test positive. If you do have any questions on this, keep us, please contact our office. We can definitely answer any questions along the way that come up. And then again, I think just to echo what Marion has said, we can do a lot of things to prevent the spread of this virus. We know how it's spread. We know that wearing masks are extremely, extremely important. We know that social distancing is extremely important. Keeping the number of people that we're coming in close contact with small to help decrease the spread of the virus on campus. So thank you for everything you guys are doing, and hopefully we can keep working to keep campus as safe as possible.
Thanks so much, Dr. Martin. That is the information, and those are all of our panelists. And now we're going to go to a couple follow-up questions based on some of the comments that were made and some thoughts that have come in. So the first question, and not really a question, just more of sharing of information. And this is for Joe Beeman. Joe, you talked a little bit about the allergy approach to food with allergies, and you mentioned the representative that they should be in touch with. Could you give that contact information so that our parents and students can reach out?
Yeah, absolutely. So Kristen Grover is our registered dietitian. So it is, let's see. If you go onto our dineoncampus.com/PIT website, you can there's two ways you can do it. I would recommend you can go on Meet the Team. You can go right to Kristen's information, or if you want to talk directly to our executive chef, I would recommend doing that as well. So, and she's at kristen.grover at CompassUSA.com, but it's probably easiest to go and do that from the dineoncampus.com site.
Great, terrific. Another question for Kathleen Kyle, and it's just specific to the student ID cards. If a student hasn't gotten it by the time they come to campus, or if there's an issue with their card, how should that be handled?
Sure. If you've pre-submitted your photo to us and you are moving into an on-campus residence location, your ID card will be waiting for you at your check-in station or with the allied security guard at your building. If you've pre-submitted your photo to us and you are a commuter student or you live off campus, you can pick up your ID at Panther Central. If you have not pre-submitted your photo, we would ask that you would do that. You can find all those instructions on pc.pitt.edu. You can pre-submit your photo, and then they will print your ID and have it waiting for you at Panther Central. Again, we are looking to be as contactless as possible in all of our services. So pre-submitting your photo really helps all of us stay safe and healthy.
That's great. And Kathleen, one follow-up question for your area. Some parents and students and families have questions specific about their residence hall and rooms. And I know we have that information online. So can you share where they can go and get that information about the specific hall that they've been assigned to?
For sure, for sure. If you go on that pc.pitt.edu website, you click on housing, there is we call them one-pagers. So like one website page on each of our residence halls. We've added the hotel facilities this year. It will tell you things about room dimensions, amenities in the rooms, type of furniture that's in those rooms, and give you more information about each of our locations.
Great, thank you so much. This question is for Marion. Marion, can you make some general comments about how students and families should handle medical forms, how information can be shared, and can they be notified about their students' medical care? So if you could just make some comments about that, that would be great.
Certainly. I think one thing that I want to impress on everybody is that Student Health Service, as well as the Counseling Center, takes into effect confidentiality and privacy of our students extremely seriously. I mean, obviously, we abide by HIPAA rules at all times, but I think all students can rest assured that what is discussed and done in student health stays there with the student. We will only share information with any other person, whether it be a parent or a guardian, at the specific request of the student. And this can be done one special way. A student can request to us that they're interested in having us to have a conversation with one of their parents. They can sign a request to share PHI, private health information, with them, and then that call will be made. Otherwise, we cannot and will not provide any additional information. A student, of course, can provide any information and share any information that they wish with their parents. In terms of documents, there are a variety of different materials that we would like to receive from you. You can do this a couple different ways. One very important piece is the required immunization records. Please be very timely in submitting your records. It's very important that we know what your status is. So that can be done a variety of different ways. It can be faxed. All this information is on our website. It can be faxed. It can be uploaded in your secure portal, or it can be dropped off or mailed. So whatever is most convenient for you. And in regard to medical histories, we would prefer that the student complete that and upload it in our secure portal. And instructions are on our website.
Great, thank you so much, Marion. We have had a question come in regarding some Wi-Fi access in the Wyndham, and I have spoken with representatives from our IT, and currently Pitt IT is working with the Wyndham and their service provider, Windstream, and they are in the process of addressing that. We also have one follow-up question, and this is for Dr. Martin. Is the random surveillance testing in addition to the 400 to 500 student testing that is being performed, or is it a part of it?
It's a part of it. So the way that we wanted to do surveillance testing is the goal was to test about 10% of our population. And with our colleagues over at the Graduate School of Public Health, they helped us identify how many students we would really need to be able to test to get a meaningful number to really estimate what is the prevalence on our campus. So that's where we originally generated that. Now, we didn't want to test everyone all at once because we do want to make sure that we're doing social distancing, that we're making sure that this is safe as possible. So we spread the testing over multiple days. And then as we spread it over those days, it ends up being about 200 to 250 per day. We still have 6 additional days of testing coming up. So more students are being tested as of today. And then as soon as we have some more results, we'll definitely share that with you guys.
Great, thank you so much. Jill, this is a question for you. How is campus recreation and how are we as an institution approaching club sports and intramurals for the first semester?
Yeah, thank you, Brian. So intramural sports are we're still offering those, and as I mentioned, we're starting to take signups for those in the next couple of weeks. Well, the main thing that we've done with the intramural sports is we've chosen activities that are lower contact and really support the physical distancing. So again, it's things like kickball and dodgeball, where as opposed to something like basketball, where you're really in close contact. Now, in regards to club sports, we're waiting to hear some additional information. We do know at this point that off-campus competition probably will not be held, and as well as competition coming on campus. However, we are really looking at the option of students still being able to participate in their clubs through activities and practices. So for instance, maybe if it's a basketball team, instead of playing 5-on-5, you have the option to be practicing your skills stuff. So everything from shooting to dribbling to free throws, that sort of thing, but it wouldn't be the high contact you would normally do.
Great, thank you so much. This is a question for Dr. Martin, and a good question to clarify our testing process. Is all testing a nasal swab test?
So there's two different types of testing that we're doing. So one is for people who are getting surveillance testing. This is what we're doing to estimate on campus for people who have no symptoms, what is our actual prevalence on our population. And then there's also symptomatic testing, which we do for anybody who develops symptoms while on our campus. So if you're getting surveillance testing, all of that is being done by nasal swab, which is not as aggressive as the nasopharyngeal swab that you guys may be familiar with or seen videos on TV or something, where you actually do it within the nose. It's more comfortable, it's less invasive, and so that's what we've selected. It's also very effective. Now, anyone who gets referred for symptomatic testing, it's going to depend on where the testing is being done. Many testing locations that do symptomatic testing in our area do it through a nasopharyngeal swab. So when you do, or if you do develop symptoms and get sent for symptomatic testing, you can ask the location. Most are still doing nasopharyngeal swabs.
That's great. And then another follow-up question for your area, Dr. Martin, and your role on the COVID-19 office. Can you talk about some of the factors that go into determining what our risk posture is for the institution?
So there's a lot of pieces that go into deciding what the risk posture is. One component, obviously you guys have heard a lot about, is our surveillance testing we're doing on campus to understand approximately what proportion of our population arrived on campus asymptomatic with the virus. But in addition to that, we're also looking at what proportion of our students have symptoms. We're also looking at what's happening within Allegheny County. Are we having high rates in our area, which would be at a higher risk for potentially ending up on our campus? We're also looking at what's happening in our local hospitals. Are we having increased rates at our local hospitals, increased hospitalizations, poor outcomes? We're also looking at what's happening on the staff and faculty side. Are we having increased cases in those areas as well? And then beyond sort of just looking at cases, we also really want to think about the prevention measures. You know, I think when you get to the point you're already having cases, you've kind of missed the opportunity to really prevent the spread. So we're also taking a look at what is our mask compliance, what is our compliance with hand hygiene and social distancing, all the stuff that we know is really, really crucial to decrease the risk of spreading the virus on our campus. So all those things really go into that recommendation and whether or not we would recommend a change in our posture.
Great, thank you so much. This question is for Julia regarding academics. Will Pitt let professors teach in person if they want to in our current environment?
I would say in our current environment, no, because we're in remote only. With the elevated risk posture and with Flex at Pitt, all classes are remote with the exception of just a handful of labs, and that's based on dean's approval. So it's just a handful of courses that currently in this posture are in person, but virtually every other class is delivered in the remote space. Now, hopefully, once we move into the guarded risk posture and classes are back in person, if a faculty member chooses to teach in person, they are welcome to do so.
Great, thank you. A question came in regarding an article that the Pitt News has reported about students not following some of our behavior guidelines and how it's being addressed. Our Vice Provost and Dean of Students, Dr. Kenyon Bonner, sent an email to all students yesterday outlining what our expectations are as a university, and this is being reinforced and followed up with all of our students through a variety of means, including staff in our residence halls and security personnel on campus. And we are taking this very seriously and do plan on responding appropriately. And if that means removal from housing for certain students if they don't comply, that is a potential option. For off-campus students not being able to access campus facilities, we are really wanting to work with our students to prove that we can manage this as a university. And so Kenyon's, Dr. Bonner's email yesterday was laying the groundwork for that to make sure that we nip this in the bud now and demonstrate what it means to be a member of our Pitt community. So great question. Appreciate you sharing that. That is actually all of the questions that we have in the Q&A function right now. But I do know how these sessions go. In about 5 or 10 minutes, somebody's going to think of that question that they should have asked. And so I want to give our panelists an opportunity to share their contact information for their service area for the best way to get in touch with people. So we'll go in order that our panelists presented. So Kathleen, for questions regarding housing and move-in and Panther Central, what's the best way for them to be in touch?
Sure. I would ask you to do a search on our website, pc.pitt.edu pc.pitt.edu. There's a lot of information crammed on that website. There's a special COVID-19 updated area as well. So please take a look at that. If you need specific questions answered at this point, I'm more than happy for you to email me directly, and you can reach me at kak58@pitt.edu. Again, kak58@pitt.edu.
Thanks so much, Kathleen. Joe, for questions regarding dining services, how should
Yeah.
our parents and students be in touch?
Yeah, thanks, Brian. You can always email me directly at jbeeman, B as in boy, EAMAN, at pc.pitt.edu. You always can go onto the dineoncampus.com/Pitt website. It has everybody's contact there from Compass that you might want to get a hold of, as well as just information that might answer some of your questions. So.
Great. Thanks so much, Joe. Dr. Spears, for questions pertaining to academic affairs on campus, how should our students and families be in touch?
Yeah, so again, the website that we are putting a lot of information on, all the infographics on the Flux at Pitt, modalities and other information on study spaces, et cetera, is at pi.tt/Pitt Student Success. On that page, you can also find information if you're a grad student, how to reach out to the Vice Provost for Grad Studies and also the undergrad Vice Provost. So VP McCarthy at pitt.edu is a universal email account. A lot of us check that. That's probably the fastest way to get some of your questions around academics answered.
Great. Thanks so much. Brianne, for questions pertaining to new student programs or how students can access a session if they missed it.
Yes, so you can call us. Our phone number is 412-648-2172. Email is orientation@pitt.edu, and website is orientation.pitt.edu. When you are on that orientation website, you'll simply click on Welcome Week, and that will take you to the Welcome Week website where you'll see those recorded videos, you'll see the schedule for remaining events, and you'll also be able to peruse the new student programs website. There's information for commuter students, transfer students, and upcoming fall events.
Excellent. Thank you. Marion, for follow-up questions about our medical care on campus, how should they be in touch?
Absolutely, Brian. Probably the best way to obtain information about the Student Health Service and perhaps schedule an appointment is to call us. Our number is 412-383-1800. Also, if you have any forms that you want to fax to us, our fax number is 412-383-1846. Of course, you can get additional information about our services, hours of operation, helpful healthy you tips as well on our website, which is www.studenthealth.pitt.edu. And lastly, please don't hesitate to reach out to me. My email address is msv8, that's M as in Mary, S as in Sam, V as in Victor, the number 8 at pitt.edu. Thanks.
Terrific. Thanks so much, Marion. Jill, for questions regarding fitness on campus and campus recreation, how should they be in touch with us?
Yep, for us as well, there are several different ways. First, we have an email, rec@pitt.edu. So that's rec@pitt.edu. We've got a number of people who are answering that email consistently. You can also call us directly, and that's really an easy way to connect with us. Our number is 412-648-8210. On our website, rec.pitt.edu, are a number of FAQs as well as a variety of information about specific COVID related things. And then lastly, you can also certainly email me directly, and my email is jik74@pitt.edu.
Great. Thanks so much, Jill. And Dr. Martin, if there's questions regarding testing or anything that associated with our COVID-19 medical response office, what's the best way for them to be in touch?
The best way is actually to just email our team directly at the COVID Medical Response Office, and that's cmro@pitt.edu. Send us an email that we can get back to you the quickest way through that.
Great, thanks so much. Once again, I'd like to thank all of our panelists for taking the time to educate us about all of the important information from their area. And I would also like to let everyone know that at the conclusion of this session, we will also email the attendees with some of this key contact information so that you can be in touch with the appropriate service area regarding your individual specific questions. Thank you all so much for attending, and we look forward to seeing you on campus very soon. Hail to Pitt.